So here's today's question. Imagine you and your next door neighbor, you both turned 65 this year. You're both pretty healthy, you're active, you take maybe one or two prescription generics. You both see your primary care doctor 1 to 2 times a year. Should you automatically choose the same Medicare plan? Good afternoon, everyone, and welcome to Coffee with Casey, the weekly conversation that helps you navigate Medicare with confidence. I'm Casey Album. I'm the Senior Medicare Advisor here at the Album Insurance Group in Margate, Florida. We're a family-owned agency, and for more than 30 years, we've been helping people here in Florida and all throughout the country make confident Medicare decisions. Over the years, many of my clients have started calling me their Medicare co-pilot. I always smile when they say that because, well, I happen to be a pilot. And whether you're flying an airplane or just getting ready for Medicare, the smoother the journey, the better the plan. So my role, and the reason I'm the co-pilot, is that it's your journey. My role isn't to tell you what to choose. It's to sit next to you and help you understand your options, think through the trade-offs, and navigate Medicare with confidence. So grab your favorite cup of coffee, get comfortable. Let's navigate Medicare together. So here's today's question. Imagine you and your next door neighbor, you both turned 65 this year. You're both pretty healthy, you're active, you take maybe one or two prescription generics. You both see your primary care doctor 1 to 2 times a year. Should you automatically choose the same Medicare plan? Think about that for a second, because I think the answer surprises a lot of people. So this week's Medicare myth is, if two people are healthy, they should probably choose the same Medicare plan. Now, I know it sounds logical, but it's almost never how I approach Medicare planning. Why? Well, because Medicare isn't just about your health today. It's also about your lifestyle, your priorities, your retirement plans, and how you want your health care to work over the next 15, 20, or even 30 years. That's exactly what we're talking about today. So last week, if you caught last week's episode or you watched the replay, we talked about what happens if you need a specialist. We talked about provider networks, referrals, and prior authorizations. A lot of people watched that episode and naturally wondered, so Casey, which Medicare plan should I choose? And when I'm asked that question, my answer is almost always, tell me about your life first. So let's meet Sarah and Mike. They're both the same age. They're approaching 65. They're both in relatively good health. They're active. They take the same medications, and they're in the same zip code. On paper, they look almost identical. But Sarah's fully retired. She spends several months each year visiting her family and her grandchildren in a couple of different states. Mike lives right here. He's running his CPA practice in Pompano Beach. He's part-time now, so he's playing a lot more golf. He's out on the boat. He's active, and he loves being close to home. What Mike wants is to keep seeing his same doctor, and he doesn't want what Mike wants is to keep seeing his same doctor, and he doesn't want any disruption to his routine. So who's right? Well, they both are, because they're planning for two completely different retirements. You know, this kind of reminds me of something that we learn as pilots. So two pilots can take off from the same airport. They can be flying the exact same airplane. Let's call it a Piper Cherokee, because that's what I fly. And yet they can file two completely different flight plans. Why? Because they're not going to the same destination. Some are flying north. Some are going south, maybe to the Keys. Others are avoiding weather or clouds. And yet others are planning fuel stops and food stops. The airplane may be the same, but the mission is completely different. Medicare works much the same way. Two healthy people can start in exactly the same place, but they're planning for two completely different retirements. So this is where freedom starts. When you ask the question, how do I want my healthcare to work during retirement? And that's the question that I actually encourage people to answer first. Not what's the cheapest plan, not what did my neighbor choose. Instead, how do I want my healthcare to work? So before we ever compare insurance companies or plans, we talk about life. Do you travel? Do you spend part of the year somewhere else? My dad and my stepmom do. That was important to them. How important is it to choose your own doctors? Do you have specialists that you need to see or that you want to keep? Do you want access to the best treatment centers like Mayo Clinic, Sylvester, Moffitt? Would predictable healthcare costs help you enjoy your retirement with fewer out of pocket surprises? If and when life changes, how much freedom and flexibility do you want to have? So, what I like to call the freedom first questions: do you want to choose your own doctors? How much flexibility do you want when you travel? Do you want predictable costs? And do you want flexibility when life changes? So, what do you notice here? None of those questions are about insurance companies, are they? They're about you. And that's why I believe that good Medicare planning starts with your life and not a premium chart. Now, many of you have heard me talk about my mother in law, Nancy. When she enrolled in Medicare, she was in her 70s, she had retired, she was healthy, but none of us knew what the future would bring. But Nancy knew what kind of freedom she wanted in the event that something happened and what kind of protection she wanted if things changed. Years later, Nancy was dealing with complications from COPD. She'd been a smoker, and then cancer. Not just one, but three different types. Now, the lesson here isn't that something bad happened. The lesson is that Nancy made her decisions based on how she wanted her retirement to go, and while she still had the freedom to choose, instead of trying to figure it out as she was suddenly in the middle of a medical crisis. And that meant she had the freedom to see the doctor she trusted. She got to get care from the providers that she wanted to. She never worried about whether her tests or treatments were going to be approved. And she didn't have to worry about surprise bills showing up in the mail that she had to pay. She could focus on getting care because she took the time to understand and plan her Medicare strategy at the start. And that's why I always encourage people to think beyond today. So here's today's takeaway. The best Medicare decision isn't the one that your friend, your coworker, or your neighbor made. It's the one that fits the life that you actually want to live. And that's really the heart of my Freedom First framework. So here's your coffee challenge for the week. Next time you sit down with a cup of coffee and start thinking about Medicare, ask yourself, how do I want my healthcare to work during retirement? And then write down the three things that matter the most to you. Not insurance companies, not premiums, not plans. Just your priorities. Because once you're clear on those, the Medicare decision becomes a lot clearer too. Let's dive into some of the common questions that I'm often asked. Casey, are you saying Medicare Advantage is bad and Medicare Supplement is good? No, not quite. And that's an important distinction. Every Medicare option exists because it's the right fit for someone. What I encourage people to do is think beyond today's monthly premium and ask, how do I want my healthcare to work if my needs change? So for some people, a Medicare Advantage plan might be exactly what they're looking for. For most others, having the flexibility to see providers nationwide without worrying about networks, referrals, or surprise out-of-pocket medical bills is worth paying a little more each month. Again, my role isn't to tell you what to choose. My role is to help you understand all of the trade-offs clearly so that you can then make the decision that's right for you. I'm healthy. Shouldn't I just choose the least expensive option? Well, that's certainly one way to look at it. But I would encourage you to ask a different question. What are you actually buying? You're not buying insurance for today. You're choosing how your healthcare may work 5, 10, or even 20 years from now. Remember, insurance is not for your best day, it's for your worst day. And sometimes the lowest monthly premium or even a zero premium plan ends up costing more in other ways. Other times, paying a little more each month provides peace of mind that's worth every penny. It's less about finding the cheapest option today and more about finding the right fit for the retirement that you've worked so hard to build. How do I know which Medicare strategy is right for me? Well, I'm actually going to ask you some questions rather than making recommendations. Like, I'm going to ask you, how important is keeping your current doctors? How important is it to you that if, God forbid, you were diagnosed with something serious like cancer or a serious illness, that you'd be able to go to the best specialists at Mayo Clinic or Sylvester or Memorial Sloan Kettering in New York versus just being allowed to go to a provider that the insurance company says you can? Do you travel often? Do you want coverage that's going to travel with you and work the same way when you're away as it does when you're at home? How do you really feel about provider networks and an insurance company being able to tell you what providers you can see? Do you prefer predictable monthly costs that you can budget for, or are you more comfortable with uncertainty and much higher risk in exchange for a lower monthly premium today? Once we understand what's important to you, the right strategy usually becomes a lot more clear. And that's why I call these Medicare planning sessions rather than appointments, because we're not just comparing plans, we're building a plan that fits your life. So, next Wednesday, we're going to talk about the 7 biggest Medicare mistakes and how to avoid them. Some of them are surprisingly common. Some of them can be very difficult, if not impossible to fix. And there's a few that can affect you for years to come. So, my goal is to help you avoid them before they even happen. Hope you join me next week, 3 p.m. So, if today's conversation helped you think about Medicare a little differently, I'd love it if you'd share it with someone who's getting close to retirement. And if you'd like help figuring out your own Medicare strategy, you can book a complimentary Medicare planning session with me or with someone on my team at MedicareMedicareQuotes.com/Facebook. You can call the office 954-970-4760. Christine will get you on the calendar, or just comment plan and I'll connect with you personally and we'll take it from there. If you have a Medicare question that you'd like me to answer or talk about on a future episode of Coffee with Casey, leave it in the comments. I'm Casey Alban, your Medicare co-pilot, and I just want to say thank you for joining me for another Coffee with Casey, the weekly conversation that helps you navigate Medicare with confidence. And as we close, I want you to remember, the best Medicare decisions aren't made under pressure. They're made with a plan. Have a great week, and I will see you next Wednesday. Take care, everybody.